So types of surgical wounds. So there are 4 classes of surgical wound. Type 1 is clean. Type 2 is clean contaminated. Type 3 is contaminated. And type 4 is dirty. So now we have to see the infection risk, which is 1 to 3% in clean. It is 5 to 8% in clean contaminated. Then it is 20 to 25% in contaminated, and infection rate is 30 to 40% in dirty. Now we have 4 major points in each of the classes. So first, hollow viscous. No hollow viscous entered in clean. Then hollow viscous entered in clean contaminated, and it is controlled. Hollow viscous entered but controlled. In contaminated, there is uncontrolled spillage from hollow viscous. In dirty, there is untreated, uncontrolled spillage from hollow viscous. Now the second major point. So second major point is regarding inflammation. There is no inflammation in clean wounds. Similarly, no inflammation in clean contaminated wounds. Then apparent inflammation in contaminated wounds, and severe inflammation in dirty wounds. So next point is primary closure. Primary closure in clean. Similarly, primary closure in clean contaminated. Open traumatic wound in contaminated, and open suppurative wound in dirty. The fourth major point is no break in aseptic technique in clean. Then we have minor break in aseptic technique in clean contaminated. In contaminated, we have a major break in aseptic technique. And in dirty, there is pus in operative wound. So these are the 4 major points. Now extras. So the 5th point in clean would be elective procedure. Elective procedure is clean. And 5th point is mechanical drain present in clean contaminated, and bowel preparation pre-operative. So this is the complete types of surgical wound. Clean, no hollow viscous entered. So let us look at clean. So there are 5 points in clean: no hollow viscous entered, no inflammation, primary closure, no break in aseptic technique, and it is present in elective procedures. So infection risk is 1 to 3%. Next we look at clean contaminated. So hollow viscous is entered but controlled. There is no inflammation, primary closure is done, minor break in aseptic technique, mechanical drain may be present, and if mechanical drain is present, we'll call it clean contaminated. Bowel preparation pre-operatively. Infection risk is 5 to 8%. Next, in contaminated and dirty, we have only the 4 major points, that is uncontrolled spillage from hollow viscous, inflammation apparent, open traumatic wound, major break in aseptic technique. Infection risk is 20 to 25%. In dirty wound, we have untreated uncontrolled spillage from hollow viscous, severe inflammation, open suppurative wound, pus in operative wound. So if pus is present, it has to be a dirty wound. Infection risk is 30 to 40%.